You're feeling under the weather, or you have questions about your health, and what are your options right now for care? Google a primary doctor's office, urgent care, an emergency room. Physically going to the doctor can be a high risk right now with COVID-19. So, what if there was a safer way to get your care taken care of? Welcome back to Mobility Agility Chiropractic Performance. Today's video is all about telemedicine. Telemedicine is quickly becoming a standard of mainstream care because of social distancing due to COVID. But it's really not a new idea. It first started back in the 1950s. It initially began with simple landlines and healthcare providers offering remote services so that patients didn't have to leave their home office, hotel, or frankly, anywhere they were located. Technology has changed and telemedicine has adapted. Now it includes video conference calls so that you and the provider can sit and talk face to face. Laws and policies are changing currently to increase access to this convenient, low-cost channel for delivering healthcare. If you're living in a remote area, frequently experience bad weather, or have a busy schedule that doesn't always accommodate a physician visit, telemedicine can help improve your overall well-being by providing access. Remote consultations limit the contagion when it comes to infectious disease like COVID-19, both protecting you and the provider. The need for accessible healthcare is the driving force behind the use of telemedicine right now. And research has shown that access to a telemedicine provider significantly reduces the need for people to go to an emergency room and saves you money. According to a study in 2017, the average telemedicine visit cost about $79. The average doctor's appointment, $149. And the average trip to the emergency room, $1,734. In addition to saving you money, this allows the hospital to better manage capacity, keep exam rooms and inpatient beds open for only the sickest patients. That is a phenomenal thing right now when there is a saturation risk. Now, you might have heard the terms telemedicine and telehealth used interchangeably, and they sound very similar, but there are some significant differences between them. Telehealth refers to all types of medical communication and is really the umbrella term for digital and remote healthcare services, which can include any form of technology used for communication. Telehealth is not a service, but a way to improve patient care and assist with education, while telemedicine is healing at a distance. It still indicates evidence-based care involving medical and behavioral treatment rendered by a trained clinician. Now, you might be wondering what exactly that means when saying telemedicine, and it's really the use of electronic communication to get you the health-related care you need. So it allows for non-contact care to be provided. It could be as simple as advice, reminders, to education, to complex intervention, monitoring, and even a remote admission to a hospital. This means that where you would usually schedule an appointment, you can now call to be seen from the comfort of your home. This is a great benefit to you and your family, especially in an after-hours situation. What if you could simply call an urgent care clinic and not have to drag your entire family out of bed? Through telemedicine, the care you and your family needs can be received at a distance. This method of communication has become an essential part of care, and especially right now during COVID. With today's data-driven devices, physicians can deliver a complete, evidence-based experience in any medical specialty. And really, the first primary thing that comes to coming up with what your diagnosis is an accurate history, which can be done quickly and effectively over telemedicine. This means that initiation of complex care can start here at a safe distance. It's helpful for a variety of health issues, from as complex as psychotherapy to as simple as looking at a mole by a dermatologist. Your family doctor can even help with colds, flu, insect bites, sore throats, diarrhea, and pink eye. These are some of the common cases addressed using telemedicine. And really, any care that doesn't require a doctor to directly touch you means it can be done via telemedicine. Meaning, sadly, virtual adjusting is not an option for chiropractors, but rehab exercises, home ergonomic checks, and nutrition counseling can be done at a distance. And a great use of telemedicine is if you get cut and have a suspected infection, why not call for a virtual consultation? This way you can go over your signs, symptoms, and potentially get an antibiotic prescription done all at a distance. That's a great way to keep yourself safe. You can communicate with your primary care, get your birth control medication, and it's all done from home and can be done on the same day. At Mac Performance, we're utilizing this system to assess pain and musculoskeletal issues. It can be as simple as providing some home exercises to alleviate symptoms, or for a new injury or new patient, providing the history to reduce face-to-face contact. This type of care will never replace our face-to-face time, but it does allow for timely updates without having to take the time to come into the office. Telemedicine isn't appropriate for all situations, sadly, and a significant emergency is one that you need to go in for, such as a heart attack, a stroke, significant cut with bleeding that requires stitches, or a broken bone that will require an x-ray and casting to be taken care of. Really, anything that will require hands-on care should be handled in person. However, telemedicine is beneficial for follow-up consultations of those conditions. So why not give it a try? Telemedicine may be a viable option the next time you need to be seen for sniffles, pain, or a change in medication. A quick online check can let you know if your current provider offers telemedicine services. Will it ever replace regular visits? No, but it's a great option now to reduce the risk of spreading the infection and while keeping us safe at home. And it does help make medical care affordable in some cases. Now, one also benefit, it'll reduce the time you spend waiting in your doctor's office. And it can help us get you better faster, keep you better longer, because no one has time to be sidelined. So utilize telemedicine to stay healthy while you stay safe at home. To keep up to date with future content, please click subscribe. Additional information is found in the description of this video.
All information, content, and material of this video is for information purposes only and are not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider.